This is for my exam going undergraduate students. And there are stars waiting for you. Let me see how many you people get correct. I'm sure you'll all succeed. I start with the brain teaser, and all the important spotters are adorned with a star. This is an old reusable microtome knife which we use to sharpen. So this is the knife, this is the back of the knife, and this is the handle. That much you people remember, it is enough. You will have to spot the spotters in this session. So the terms you should know, the stages in transporting, processing, what are the instruments and equipment that is being used, the reagents and their significance. Incidentally, keep guessing what this equipment is. This is a surgical operation theatre, and these are the main functional staff: the surgeons, anesthetists, theatre staff, and the supporting staff, in which we have got a lot of surgical procedures that are going on, including the biopsy, removal of a tumor, a gangrene, etc., and also frozen sections. Endoscopy is a miniature such procedure which can be used for corrective surgery as well as small biopsies. I'm just giving you some examples. So also the laparoscopic or the keyhole surgery. Advantage: small incisions, small scars, and shorter stay. And it can be used for the abdominal organs such as appendix, gallbladder, female genital tract, as well as any biopsy. Now, whatever be it, once the specimen is being removed, what happens? This is the story of the transport of small specimens from the OT, that is the operation theatre, to the laboratory. And I have got a label over here in which the patient's name, the number, date, etc. should be there. And also the container should be containing formalin, which is a fixative. And it should be at least 10 to 15 times the volume of the specimen. So from the theatre, it goes to the laboratory with all the details and formalin. Now what happens when the specimen is large, such as a uterus or a huge tumor? Then obviously the size of the container will have to be changed. And this also shall be filled with 10% formalin. And what will happen is the specimen will have to be completely immersed. And this is the label that has to be filled, stuck onto the container from the OT to the laboratory. This is extremely important, as I had mentioned earlier. The name, what is the nature of the specimen, the hospital number, whoever is the surgeon or the unit, the date. So these are important ones. And now that everything is being computerized, the bar coding is essential, which carries similar details, and it will be there in your hospital also. This is another extremely important data that we require: the surgical pathology request form, in which again the details will be there, all the thing, what is the provisional diagnosis, etc. Along with that, I would need the clinical history, the surgical history, any radiological finding, previous treatment, etc. All should be filled in so that without any trouble we shall proceed. And once you people give the specimen, this is where we take it to. So this is called the grossing station. In this station, there will be the knives, there will be an inflow of water, there will be an inflow of formalin also will be available, and we can change the fixative if required. And this is the grossing table in which the grossing is done, And finally, unwanted specimen will be discarded or again put back into the bucket, and the necessary ones alone look at what this technician or pathologist resident is doing. So they are meticulously processing the important tissue and putting it into a capsule. This is called a tissue capsule. As I told you, count the stars. This is extremely important. What are the stages? Now what happens is you people have sent it in formalin and we also put it in formalin initially. After that, there is an ascending grade of alcohol, 50, 70, 90, 100%. Gradual grading so that there is not much contraction of the tissue. Then the alcohol has to be cleared. We put it in a clearing agent such as xylene. So here we are having the xylene, multiple containers, and it is put in molten paraffin or paraffin wax. So this goes on automatically. I would like you to correlate this cycle with the first picture that I had shown. I'll be showing it to you again. Earlier, all this was manually done. So remember, fixation already done. Then there is a dehydration, there is a clearing, there is an embedding in paraffin. It goes. Again, I repeat, processing. Repetition is the mother of knowledge. So your precious tissue is put into this along with the biopsy numbers because we will be having a jar that processes multiple tissues, 50 to 100 tissues, and there should not be any mix up at all. Therefore, they are put in tight tissue capsules which will allow the percolation but prevent the loss of tissue. So the stages you people please remember: fixation, dehydration, clearing, impregnation. Count your stars. Can you explain this? So I told you there's a tissue capsule, what all happens within it, what you people put it, and where you put the tissue capsules. They are porous, I have mentioned, the tissue is not getting lost, and multiple tissues can be processed simultaneously. This is my age-old friend, the Leucard's L mold. So it is L shape. I am not having a rectangle or a square, but two L's instead, so that the size can be adjusted. It is made up of brass or any alloy. It has got flat edges. And we put the tissue on a glass plate and we do the process called as embedding. Embedding means we pour wax and it gets solidified. The size here can be adjusted accordingly. So these are the Leucard's L. One more star for you. And this is our friend, the paraffin wax. I told you in the tissue processing itself, it is becoming molten and it can be used for processing, or after you people finish the impregnation, I take the tissue out, I again repour it so that I produce what is called as wax blocks. So the tissue that you had sent me is like this, or what I had sampled is in the form of wax blocks or paraffin blocks. And these are attached to an instrument called the microtome. So this is where, and the sections are being cut. I'm getting serial sections of this. So can you remember the stars? And I hope you people know this. This is a step of correct embedding. Impregnation happens during processing. After which, again, this is again the embedding that is being done. I pour the wax into it, it gets solidified. Attached to the microtome, sections are being cut. So this is the instrument called the microtome, extremely precise for 5 to 10. So this is the instrument called the microtome, and it can cut sections less than 5 microns. 1 micron is 1 by 1000th of a millimeter. This is again a star kept for you, a disposable blade, disposable microtome blade that is over here, and the sections are being cut. So again, a microtome blade, disposable, made of steel or alloy, extremely sharp. Handle it carefully. Used for cutting thin sections and this is the dimension. And the angle between the knife and the tissue block is 15 to 20 degrees. Stars here. Again, the stars continue. Now, why am I having? This is a kind of a water bath. The temperature can be adjusted and it is black in color. Inside also it is black so that when I put the tissue, it can be seen against a black background very easily. And after that, after it unfurls or uncurls, I will transfer it to the glass slide. And this instantly is a frosted slide where I can write the details in pencil. Multiple slides can be kept in a slide carrier like this. And what will happen is they can be used for staining together. So the frosted slides over here, and this is the cover slip. After the staining, everything is over. We put the cover slip after a mountant is being applied. So frosted for writing, transparent, the slides are covered with the cover slip because of better resolution, and also you have a glass marking pencil for marking. So this is called a diamond pencil. Count the stars again. A spotter for you, which has got a diamond tip, which is very sharp but very cheap also. Glass marking, and for permanent marking, it has to be retained for years and years. This is a Copland jar, another friend of ours. Again, the stars. So there is a tight lid over here, and if I see some are made of glass, I can see them. Otherwise, if they are made up of thick plastic, you will have to see inside. There will be multiple ridges. The ridges are used to prevent the slides from sticking to each other. And if you are very clever enough, you can keep two slides back to back in arrangement so that you can have. Now there are 5 ridges, so I can keep at least 10 slides in this Copland jar for either part of processing or for staining. DPX. So this is the expansion, diastine dibutyl phthalate xylene. This is the mountant we put on the section and then the cover slip. It has the same refractory index as glass, so it makes it transparent. So look at the number of slides. Obviously, there should not be any confusion. Hence, the numbering is important. And after all that, reporting is done by the pathologist under the microscope. And what is more important than the eyes is what is behind the eyes. And after reporting, you find that hundreds and thousands of slides will be stored for obvious purposes, for the patient, for the institute, for research, etc. And sometimes very good specimens are not thrown off. They are sent to the departmental museum for mounting. This again a star for you because it is a spotter or a viva question. So it is a perspex or an acrylic jar. So it can be cut into different sizes by means of the acrylic plate. So what happens is instead of a single solid glass jar, I can have the various changes made in this. It is again transparent, lightweight, and it can be cut. The Kaiserling solution is the solution we use for mounting the museum specimens. So this is what I had shown you earlier. So I told you that there are various steps. Earlier we were manually doing it. Now all these can be digitized or it can be time set so that there is a central lever which goes up and you find that it moves from one station to another. That is shown over here. So you are having the fixation, then the dehydration, followed by the clearing, impregnation in wax, and after that we take it out. It goes in for embedding and section cutting. So this is the thing. You start from here, you end here. This instantly, another star purposely I kept. What is a cryostat? Can be asked. So this is actually a refrigerated microtome. I'm having a microtome within a freezer-like equipment. This is called the cryostat. So there is a low temperature and the tissue automatically freezes with the surrounding water as ice. This helps in the support and it is being cut. Now, what is the advantage? Why are we in such a hurry? Because the patient is on the operating table. Within minutes, I have to give the diagnosis, a rapid diagnosis, so that the surgeon can proceed or alter the surgery. To demonstrate some substance like fat, they are dissolved during processing, and some enzymes are also destroyed. And to retain them, the frozen section can be done. This also can be a question. Thank you, students.